yes, of course, you can have some areas of tissue destruction and inflammation that occurred because of the infection, and persist in causing some symptoms even after the infection is treated.
There's a question that comes up quite a bit, which is how can I tell if the symptoms I'm experiencing are because of an infection that wasn't treated properly or because of inflammation that remains after an infection was treated?
That's a great question. And that's something that we see all the time, where people have been, or, a woman has been treated for a UTI, but she continues to have some irritative symptoms. And I think in that situation, we have to look at the sort of trajectory of those symptoms. So, if the symptoms are sort of getting gradually worse, where you're noticing that you're requiring like peridium every day, and it's
Hmm.
keeping you up at night, and you're waking up 3 or 4 times, whereas that's not what you normally do, then I think you have to consider that this may be an infection that wasn't fully treated, and now the bacteria, since you've come off the antibiotics, the bacteria has a chance to emerge and cause another inflammatory response in the bladder. But I think if you notice that, a lot of women will notice that, they don't have symptoms that were as severe as the initial infection, but they notice, for example, that when they have to urinate, there's a greater sense of urgency than there used to be.
Hmm.
Um, and so there can be these more mild symptoms, which I think are a sign of the bladder. Number one, being sensitized. So you have nerve endings, which normally aren't active, which become active during the infection, and then start responding to bladder stretch, whereas they normally wouldn't. So you feel a greater degree of urgency, like your bladder doesn't go completely back to the way it normally was. And then, yes, of course, you can have some areas of tissue destruction and inflammation that occurred because of the infection, and persist in causing some symptoms if, even after the infection is treated. So I
Hmm.
think you really have to look at the direction that those symptoms go in. Does it feel like, it's not as severe as that initial infection, but you're just noticing an increased awareness of your bladder that you didn't have? And I think it's always reasonable to retest the urine. And if you see clearance of, like, white blood cells and red blood cells and those inflammatory markers, those markers that occur during acute inflammation, then, and the symptoms are getting better, not worse, then you can assume that, your bladder is just sort of healing. But I
Hmm.
think if the symptoms are getting worse, or, to the point where you feel, exactly the same as you did at the time of the initial infection, then you have to be really suspicious that maybe it never cleared.
Hmm. How long can the post-infection inflammation last, and what would you do to help relieve those symptoms?
So I've seen it last actually a few months. I've seen patients who also get, recurrent infections, like, 3 or 4 times a year, where, their bladder is almost in a constant state of a little bit of like a low grade inflammation.
Hmm.
When we've put, and almost to the point where, we might even diagnose like overactive bladder. And then when we've put those patients on a good prophylactic regimen, and I always think if I can get them a good sort of like 6 months without getting a UTI, their symptoms seem to get better. So, meaning that, they say, oh, actually, I don't have an overactive bladder anymore. My bladder just feels normal now. So I do think that being vigilant about, prevention, and really trying to make sure that you don't get another infection is important in that healing process, because every time that inflammatory process starts, you're going through that same phase of tissue destruction and inflammation all over again, and you
Hmm.
really want to be able to give your bladder that time to heal. So I've seen it last, a few weeks to months, and we certainly use things like peridium, Urabel, Tylenol, ibuprofen, things that essentially help to ameliorate the symptoms. But I do think it's really important when I see women who have had these symptoms because of a UTI. I also
Mm.
really want to get them on a good preventive regimen, because I know that if they get another infection, um, it's a step backward in terms of their inflammatory symptoms.
And what does a preventive regimen entail from your perspective?
So typically, a preventive regimen would be things like a very good quality high PAC product. I like to use Elora in my patients, or Utiva is another brand that makes a good quality product. And those products typically have 36 milligrams of PAC, which is proanthocyanidin, and that's the active ingredient in cranberry that prevents bacteria from adhering to the lining of the urinary tract, which is the primary mechanism that bacteria uses to ascend into the urethra and cause an infection. And so that's why we talk about cranberry, in UTIs. The problem is when people drink cranberry juice, often they're not getting enough of that enzyme. And the studies that have been done on cranberry have been somewhat equivocal, but that's also because there's been a large heterogeneity in the types of products that were used.
Mhm.
Now, in this country, the supplement industry is not regulated. So, anybody can put anything in a jar and call it whatever they want and
Mhm.
sell it as whatever they want. So when we recommend supplements, it's hard to know, what is a good quality brand. So Elora and Utiva are brands that I recommend because the concentration of PAC is actually tested in a third party lab. And I've been using, for example, Allura. I've been using it in my practice also now for about 5 years, and I've seen that it works really nicely in patients. Sometimes I even have people, they take one a day, and one pill has 36 milligrams of PAC. And then I'll have them, if they start feeling any symptoms like starting of a UTI, they'll take two, or they'll take a second one if they have any sexual activity, and that helps to prevent a UTI from coming on. So certainly I use that. I think the only side effect of doing it is potential like GI symptoms. Some people feel
Mhm.
it's a little harsh on their stomach. And some patients with IC are concerned about the potential that it's acidic and it may aggravate their IC symptoms. But I actually always suggest that people try it
Mhm.
because most people tolerate it really well. So that's number one. Number two, in postmenopausal women, I definitely use vaginal estrogen. I think that's also a very low risk, high reward
Mhm.
strategy. The concerns about using estrogen in terms of it being a hormone are really more relevant to using estrogen as hormone replacement therapy. And so, one thing I find it's really important is to, inform my patients that when you use it in the vagina, it's not elevating your blood levels of estrogen to a premenopausal woman. It is not hormone replacement therapy.
Mhm.
Um, and I think, in one of our other questions, we were talking about the utility of vaginal estrogen
Mhm.
and the UTI Global Alliance, where they just did this fantastic series of lectures from researchers, from microbiologists and
Mhm.
immunologists, and one of the talks was by a woman from the University of, I'm sorry, from Washington University in St. Louis, and they're actually showing that vaginal estrogen in mice, when they administer it, it actually helps the tissue healing process in the bladder after a urinary tract infection.
Okay.
And I think that that's an area of really great interest because the healing process and what happens and how that varies from person to person and how that affects the symptoms that you may continue to have after you get a UTI
Mhm.
is a really important part of how we are going to clinically approach patients. So, vaginal estrogen, I think, is like a very low risk and high reward strategy. And also helps with genitourinary syndrome of menopause, which can cause UTI like symptoms. And vaginal estrogen also works, by enhancing the healthy vaginal microbiome, enhancing the growth of lactobacillus in the vagina, which decreases the prevalence of uropathogenic bacteria that can form reservoirs in the vagina. So I definitely do that. The evidence for probiotics, also is equivocal. However, I find taking a probiotic is, a harmless, and potentially beneficial thing to do. Um, you know, I would love to see more studies on how oral probiotics
Mm.
populate, whether, the presence of that bacteria or that probiotic, those strains of lactobacillus that you take orally, if you're actually able to populate the bacteria in the vagina once it transits through the GI tract.
Mhm.
Um, I have used vaginal probiotics, in some patients who don't find it irritating or, goopy, or
Mhm.
who don't have any issue using something in the vagina. And so, I feel using a probiotics can potentially help and, can't hurt. So I do that as well. And
Mhm.
then the last thing would be, postcoital prophylaxis. Yeah, I think that's a very appropriate strategy and works really well in a lot of patients. And you're certainly better off taking, for example, one pill of nitrofurantoin after intercourse than having to take like a whole, 3 or 5 day course of therapeutic dose antibiotics, if you get a UTI. So, I think there's a lot of things that women can do, which are, relatively low risk and can really help to prevent UTIs. And then the other thing, of course, is, fluid intake. There was a study that was in JAMA about a year and a half ago showing that when women increased their fluid intake by about 1.5 liters, their frequency of UTIs decreased. So that's, of course, important and, generally
Mhm.
good for you.
Is there any concern about antibiotic resistance with the prophylactic treatment?
With postcoital prophylaxis, especially with nitrofurantoin, we have not seen it. I have seen it when I have used daily low dose prophylaxis,
Mhm.
either with nitrofurantoin or particularly with Bactrim, trimethoprim. You can use either trimethoprim alone or just like one pill of low dose Bactrim, or single strength Bactrim a day, which is trimethoprim combined with sulfamethoxazole. I have seen it with that. But for postcoital, I have not seen it. And even in women who have said that they took their nitrofurantoin after sexual activity and they still got a UTI, when we do the culture, I often see that the bacteria still remains sensitive to nitrofurantoin,
Mhm.
but they just, they need a treatment course. Just one pill wasn't enough because they really did get, the bacteria was very successful in,
Mhm.
causing that infection.